Good afternoon, everyone. Thank you, speakers, for coming and finding your name. We're now having our second session of the day, Implementation and Administration of the Food Packages, and we have a dedicated team of WIC professionals here, experts in WIC, who have come from many corners of the United States to talk to the committee. Thank you all for coming. We have some terrific committee members from all walks of life, but you are our WIC experts, and we look forward to hearing from all of you today. So let me tell you who we have here. Well, my order is different, so I'm going to read off my paper. Lindsay Rodgers, she has her name there. She's here with us from the Texas Department of, that sounds funny. Department of State Health Services. You say it differently than we do in California. She has served as the Nutrition Services WIC Section Director for Texas Department of State Health Services since September of 2013. But prior to that position, she served as Deputy Assistant Commissioner for the Food and Nutrition Division at Texas Department of Agriculture, where she helped oversee administration of 12 USDA federal nutrition programs. She also previously held a lead position in the DSHS Nutrition, Physical Activity, and Obesity Prevention Program, where she championed development of the Farm to Work program. Lindsay is a registered dietitian, holds a Bachelor of Arts in Dance, and a Master of Arts in Health Education from the University of Texas. Marie and I enjoyed meeting Lindsay when we visited Texas, so thank you for touring us around. Janet Moran, we have two Janets, so Janet Moran is in the middle. She's here from Wyoming. She has over 35 years of state government service, including her role as Wyoming WIC Program Manager since 1996. She is the chair of the Mountain Plains User Group. That includes the WIC programs in Wyoming, Colorado, Utah, North Dakota, Iowa, Nebraska, Nevada, and Vermont. That doesn't sound like it's in the same area. She was actively involved with the design, development, and implementation of the original Mountain Plains States Consortium state agency model, which we fondly call a SAM. It's a SAM system built for Wyoming, Colorado, and Utah, as well as the development and implementation of the EBT system for Wyoming, which came up in 2002, which is about 10 years before any other state came up on EBT. So thank you for coming, Janet. She's a former board chair of the National WIC Association and is the current NWA Legislative Committee chair. She's a member of both the American and Wyoming Academy of Nutrition and Dietetics and the Association of State Public Health Nutritionists. Rachel and David, you both had the opportunity to visit Janet in Wyoming. So our committee really benefited from seeing many of your programs. Janet Jackson Charles, you met this morning. So we know she's from Washington, and I think, is that sufficient?
Works for me.
All right. Great. Debi Tipton, she's been with the Chickasaw Nation WIC program for almost 30 years. She is a registered dietitian and plays the dual role of manager and nutrition coordinator. Over the past decade, she's devoted her passion and energy into reinventing the Chickasaw Nation WIC program. Believing that the purpose of WIC goes far beyond feeding families, it will be most powerful when WIC staff help families adopt healthy behaviors that will allow their children to fulfill their hopes and dreams. Debi has served on the National WIC Association board. She currently serves on the NWA Evaluation Committee. She's passionate about preventing obesity and diabetes in families. Helen got to visit Chickasaw Nation during our visits. And last but not least, Mary Blocksidge is here from the Massachusetts Department of Health and Human Services. Mary joined the Massachusetts WIC program in 1986 in the role of vendor manager, and in this role she is responsible for managing the retail store component of the Massachusetts WIC program, including authorization of over 1,000 retail stores to WIC. Retail store training, communication, and liaison with the retail community, retail store fraud and abuse detection, investigations, disqualifications, and managing and updating the WIC-approved food list. And I can tell you our committee knows very little about that, so we're looking forward to learning from you all. So we have a real incredible WIC experience here. This panel has chosen a different approach than our previous panels, and it's going to be a sort of more of a Q&A. They have seen the questions in advance, but that doesn't mean we won't have more questions that are going to emerge as a committee. So I'll be seated here asking questions. There will be circumstances where the question has been answered, so all five won't necessarily be answering. We can move on from there. There will be some questions, though, that I expect we will be hearing from all of you, and we look forward to that. So while I'm getting seated, maybe we'll start with Debi and move across. If you could just let our committee know a little bit more about your program, how many you serve. I think I've already said where you're from, just to get a sense of the size and whether you're on EBT or not. Thank you.
Okay. Well, I have to pretend I didn't hear the whole session that we just had. You just took the passion out of my talk.
It's okay.
It's teasing. The Chickasaw Nation is in the south central part of Oklahoma. We are one of 9 tribes that reside in the boundaries of the state of Oklahoma. Chickasaw Nation serves approximately 4,000 clients a month. We have co-joined with the state of Oklahoma and the other Indian tribes to form a unified food list. And so the answers that I give you today regarding any food questions would apply to all of the Indian tribes in Oklahoma as well as the state of Oklahoma program.
So in Texas, we serve about 865,000 a month. And we have about 2,200 grocery outlets. And in terms of clinics, we're at about 550 clinics to serve those participants on a monthly basis.
Do this successfully. Oh, it's stuck. In Wyoming, we're actually I think we're the 9th largest geographic area state, but we have the smallest WIC caseload in the country, and we were the last state to implement WIC in 1980. And I'm fortunate to have been with the program for most of those years, as you heard earlier. We have 19 local agencies, and we go to 36 different communities, so a lot of traveling, as you might imagine. And we serve about 10,350 participants each month, which is, the lowest we've been for a while.
And I forgot to say we're on EBT.
Oh, yeah. And you heard we're obviously on EBT as well.
And we're on EBT.
Okay, in Massachusetts, WIC has about 122,000 participants. We're down by about 8,000 cases right now. We have 1,000 retail stores. We have about 350 small stores, and we are on eWIC as well. We have about 35 local programs. That number is going to be coming down soon, but we did go eWIC about 1.5 years ago, and we rolled out probably in one of the quickest time frames ever, but it's well worth it. So,
1,000 stores, wow. Washington State has a caseload of about 180,000, 185,000 a month. It has been 200,000 for quite some time, and we are one of those states that's seen a decrease. Over the course of the year, we see about 290,000 unduplicated folks. Have about 60 WIC agencies, 200 or so clinics and little sites, and then only about 180 stores, so I'm quite amazed. We are still using paper checks. We're in the midst of the process of replacing both our MIS system and starting to issue EBT. And we see that, well, we thought it was 2017, and it's probably 2018 now. It's kind of a moving target. It's a long process.
It is a long process. All right, do these turn on magically? No. Yes. Oh. There's magic in the back. That was fun. All right, so committee, or what are we calling us, panel?
Yeah.
This is a WIC food package committee, so we're going to try to stay really focused on the questions that our committee has related to the food package. Of course, we're going to stray from that on occasion, and we'll try to keep bringing it back because we really look to your insights and input. Most of you, with the exception of Lindsay, lived through the 2009 food package changes, so we feel you learned a lot from that experience that you can probably bring to bear on any recommendations for future changes. And I know Lindsay has talked to many people in Texas, so it's as if you were there, right? All right, so I just want to start with a bigger question about, you've also benefited from hearing the day's comments. What foods in the packages do you all feel, or do you each feel, may not be meeting the needs of participants? Can you suggest other foods that would be more favored but still of nutritional value? If foods should be increased or added, what adjustments would you suggest to maintain cost neutrality? And by that, you know what that means. Reductions. As you all know, in 2009, in order to add the CVV and the whole grains, there had to be reductions in some of the other foods. So this is a big opening question, really having to do with foods in the package. What do you feel is missing? What do you feel could be changed? Janet, could I start with you?
Certainly,
Thanks.
certainly. Well, as I mentioned, Washington WIC doesn't have EBT, so our redemption data is not very specific. So lacking that data, we have done a survey this year of our clients and have gotten a lot of information from participants about the foods. We have a series of kind of categories of comments. Certainly package sizes are a challenge. It's difficult to find the ones that are allowed. And, you know, as a solution to that, we'd like to see a range offered so that it's not an absolute amount, and when the package size changes, we're not scurrying to change our MIS system and work with our vendors and all that. So if we could have a range rather than an absolute, that would be nice. Milk has already been mentioned, that a lot of folks don't like the 1% or skim milk, and then we want to have options for people who can't tolerate cow's milk, potentially rice, coconut, or almond milk. Everyone would like to see an increase in the value of the CVV, and an increase in, we had a request for increases in peanut butter, beans, and milk. We'd like to see this, I mentioned this earlier, an easier way for parents to make baby foods, to have the fresh fruits and vegetables as an option and part of the family food. And one that's really important, I think, recently diagnosed with type 2 diabetes, to have fruits and vegetables as an option for juice for clients who are diabetic. That's not really a cultural issue, but it would add to some of the comments that we heard earlier. And being in the Northwest, we have lots of, I don't know if it's more, it seems like we have a lot more vegetarians and vegan folks out that way, and so there's lots of questions for staff around that and how we can better accommodate those needs.
Thank you. I have on my notes that I'm asking Janet number 2.
The other Janet.
Yes.
Well, interestingly, our comments very much mirror what Janet has just said. And I did take the opportunity to poll some of my colleagues in the Western or Mountain Plains region, and I heard back. So some of these comments also reflect Missouri, Iowa, Montana, Nebraska, Utah, and then the Northern Arapaho tribe in our state. But again, we also, probably one of the most important things is to be able to have a range of sizes of foods that participants are able to purchase, because that's a stumbling block at the grocery store, and often does lead to a negative shopping experience, which is certainly not what we want. Several of the states mentioned, and we hear this from our participants, more fruits and vegetables for both, children and women, particularly as even an incentive for breastfeeding women to have a higher percentage or probably a higher dollar amount, than we currently have. I looked at since we've had redemption data for a long time, but I will have to say, I wished we had more staff and opportunity and resources to analyze a lot of the data, because it's fascinating. And I think what all of us have found when states initially go to EBT, the shopping patterns really, the times that people shop, I think stay relatively consistent as when they have checks. It's usually 3.5, 4 times a month. But since they can buy whatever they want, when they want, and go as often to the store as they want, they aren't compelled to buy everything on a check or lose it or forfeit it. But unfortunately, what we saw is quite a lot less redemption of food, which certainly isn't the intent. And so we really tried to focus a lot on nutrition education efforts to say why is it that you're not utilizing all the foods that we provide. But in looking at the data, some of the things that are redeemed at the lowest amount, and I just looked at things that are less than 50%. In the infant cereal, it's 38% redemption. Infant meats is the lowest of all, about 27.3%. Women's juice, about 41%. But again, some of the suggestions of adding, instead of juice, maybe more, fresh fruits and vegetables, or CVV benefit. And I don't know, I really didn't sit and, I think some of the suggestions may or may not be and I know it's important to consider the cost neutrality, but at the end of the day, you want people to eat what we're providing. And so maybe, I don't think we're ever going to get, I wish we probably could, to get to 100% redemption of all the foods, but I think the reality is that whatever we can do to have them redeem the most they possibly can is important. We also had comments about the options because of folks that have milk allergies. Soy may not be always the best choice because some folks who have milk allergies also have, problems with soy, and so maybe an alternative is was Janet mentioned, we had folks mention oat, rice, and almond milk, I believe. And then we did look at redemption of our milk when we went to adjust the requirements to go to 1% or skim. And when we had 2% on the program, we had about overall a 65% redemption of milk. And now, in looking at that, it's dropped about 10% overall with just the 1% or skim. So again, maybe a consideration for a revisiting of that particular issue, because we want people to consume, milk, lower fat milks in particular. And then allowing the full substitution for the cash value for jarred baby foods, fruits and vegetables, having a full substitution for CVV for that might be an option. And the last thing, and I believe this was something the National WIC Association also recommended or suggested, that maybe a vegetarian option for some of the infant meats. I know it doesn't necessarily address the heme iron requirement, but maybe beans or lentils as a substitution. And finally, we also had comments about the vegan substitutions for the eggs and canned fish, because right now it's just with the homeless package and not for the other folks.
Thank you. Debbie, did you want to comment?
I don't have anything, I have a couple things maybe just to add. As far as redemption, the redemption day that we looked at was, we've been EBT since 2010, right after the rollout of the food package. And I do want to say thank you too. I have a handout that I'll leave for the committee if it's appropriate to do that with our redemption data and the chart that we did. It is a little disappointing, as Janet and I talked about earlier, and we still are trying to tease. Even though we're EBT and people think, oh, there's so much data with EBT, it's very hard to tease it out appropriately, I think. And when you see the low redemption rates, it's not necessarily a reflection of the number of people who are not redeeming. It's looking at the number of ounces of cereal, and they didn't redeem all the ounces of cereal, if you will. So, and again, it's very interesting the session that we just had, because we have a lot of talk within WIC about why do folks not redeem? And I think it is like Janet said with EBT, with the checks, they had to get it all at once, or all or nothing. And so at least we know they're getting what they want and what they probably are consuming, even though the redemption rates may seem a little bit lower. We had the nutritionists in our area had a couple of suggestions in addition to what's already been mentioned. We would like to maybe have cottage cheese as a consideration as another dairy alternative. We feel like it is probably cost and nutritionally neutral to yogurt, less calories and probably a little bit less expensive maybe. Canned chicken, and that's already been mentioned I think today, but that was another suggestion for a meat alternative. We would like to see the discontinuation of all juice, and again, as has been said, just the ability to either discontinue juice or fully substitute fresh fruits and vegetables in lieu of juice. And we would like to see the white potatoes be disallowed.
The what?
The white potatoes.
Oh.
White
Quick
potatoes.
clarification, when you mentioned cottage cheese instead of yogurt, you didn't...
Just as an additional.
But it wouldn't be part of the cheese benefit, it would be part of
Milk and
dairy substitute?
Right, milk and
Okay,
dairy, sorry.
just
Yeah,
for
milk and dairy,
clarification.
Yeah. An
Okay.
additional substitute.
Okay. Thank you all. So I'm gonna push you a little here because that's what we do. but we push each other in these meetings we have. It's easier for all of us to come up with these cost-neutral changes and these additions. Where it's harder is to come up with the subtractions and the ways to keep it cost-neutral. So you can think about it either from a food perspective. You can also think it from a categorical perspective: pregnant women, infants, children, postpartum women, all of those. So in your expertise, given that to do additions, there must be subtractions, where is it the least painful? I mean, I'm not sure quite how to phrase this, but where in your experience would you start?
Juice. And then some of the jarred baby foods.
Yeah.
I don't know if it's different with EBT. With the check, we only have, you've got one chance to spend it. So, it's being redeemed, and then it's more than a baby can eat. So.
Any other thoughts?
No, I agree. We saw the same low redemption of the infant meat, so that's kind of an easy way, I think. And I could totally agree with Gary with juice.
And I think our jarred infant fruits and vegetables are like 46% redemption, so it's also relatively low. Comparison to other, some of the other foods. They're higher.
And in Texas, we added the option for organic baby meat this past fiscal year, and we still saw further decline in redemption
Interesting.
for that item. So we tried really hard to get people. It's just not an item they're redeeming at all. And I thought it was really compelling to hear the dietary guidelines talk about fruit consumption, because it seems like we're hitting that target. So is there really a need to go to a juice option if that's something that doesn't seem to be a primary issue there anymore? It's more the textural component of introducing those fruits and vegetables that maybe should be our focus.
Okay, thank you. I have a couple administrative type questions. The first one is fairly straightforward. It has to do with the CVV as it's currently configured in your state. As you know, everyone's required to offer fresh, but it's in a state option to require any other form. So what are you doing in your state, and what was the rationale behind that? I'll start with Janet Moran.
And we chose the option of encouraging or approving only fresh fruits and vegetables, and primarily because in a state like Wyoming, they weren't always readily available. We thought that not only would that be beneficial for our WIC participants, but would also impact what's available in the stores for other folks to buy. And we have seen that, and I'm pleased to say that even our small rural stores have been able to keep consistently good stock of fresh fruits and vegetables. I know that's not true everywhere, and even in some of the states in our region, but most, kind of like the slide that was presented earlier today, it's more of, in our region, fresh or fresh and frozen, and I think only one who responded to have canned. And some of that, the confusion of between like canned, frozen, dried products that are eligible or not eligible, just the sheer number of, as far as an administrative perspective, which, everything has to be balanced, but all the various UPCs that have to be collected and entered and maintained, it's a consideration for a small state in particular with small staff. But certainly, I think that, overall, I think having fresh fruits and vegetables has been a good thing, and we've really focused on that. And we do have about a 70% redemption of fresh fruits and vegetables. We hope that it would be higher, but you have to start someplace.
Lindsay.
So in Texas, this is a little difficult to pick up. In Texas, we do fresh and frozen. We opted not to do canned. Initially, our nutritionists had concerns about the nutrient quality and going in the canned direction. And they also brought up concerns about BPA content of the lining of the cans and making that more of a regular purchase for our participants. Additionally, they went out to the stores and checked the labels. And really what it came down to is that it would have made it an obstacle course for our participants to find the right can. Knowing terms like fructose and sucrose that might be added and whether that's going to meet the sugar content requirement or not, we thought we were putting them in a position where they'd get stuck in the lane not being able to scan a food. And so that's ultimately a huge reason why we didn't do it. There was confusion around mature legumes because you can buy frozen mature legumes with your fresh fruit and vegetable benefit, but you can buy canned beans with your legume benefit. So we've heard from other states that have done canned that there's confusion from the participant about which benefit's being decremented when they purchase that canned item. So for us, we just did canned beans, which we'll talk about a little bit later, but that makes it clear to them that that's part of their legume benefit and not being decremented from their fruit and vegetable benefit. Another thing about the canned option is if you choose to do any of these, if you do frozen or canned, you have to do it all or nothing. So you don't have the ability to just say, I'm going to do canned tomatoes because I know those are out of season and might be difficult to find. If you do canned, you have to offer every type of fruit and vegetable as a canned option. So if there was flexibility for the state to make some determinations in that area and do canned for only some options, Texas would consider doing it. But at this time, it's an all or nothing that made it too difficult for us to navigate. And I'd be remiss if I didn't mention that the baby food, the option for the states to substitute out some of the jarred for fresh, because we do fresh and frozen, that alternative is not something that we can offer in our state readily. Because we can't, in our MIS system, it's problematic, but also from an education standpoint and a shopping perspective, to tell them that the benefit for the rest of the house is fresh and frozen, but for that child it's only fresh, is a big barrier to making sure that rolls out smoothly.
Thank you. Debi?
I think the same for the tribes in the state of Oklahoma. Again, our discussion and our agreement was around the nutrient density in the can, so we decided to offer fresh and frozen only. Although we did, exactly as Texas has recommended, would love to see the IOM make some recommendations about nutrient-dense canned vegetables, tomatoes, yams, or something. If there were some guidelines that states could go by to choose as an option, we'd be very interested in that. We wanted to kind of steer folks away from the typical things we feel like they already consume, the green beans and corn in Oklahoma. So if we could have some recommendations from the committee, that would be great, we think.
So do any of you authorize canned?
Massachusetts does.
Okay, can you share what that experience has been like?
I mean, I know we work very closely with our nutrition staff. The whole program works together to decide these things, and we always feel that we want to allow all of the best options for our participants so that they'll be able to have a good variety and have shopping experience is difficult because we are on EWIC, and it was really difficult to capture all the UPC codes, but we did go before. When you have a check system, it's somewhat of a self-policing thing because you have to trust everybody to read the labels. But we did feel that it was a good option for our participants, and we haven't really had too many issues with it. I mean, we are selling mostly, I forget what the percentage is, but most of our redemption is the fresh and the frozen. But it is a good option for some of our participants. But the beans do get very confusing because, especially, and then it's the particular kind of beans that actually it's the green, I forget which, green pigeon peas fall into the fruit and vegetable, not the legume. So there's always some confusion with canned beans and canned fruits. But it would be nice to restrict, if we could, to certain products that we think would be more beneficial, and we're not allowed to do that. So, but we do allow all.
So I think I'm hearing from a number of you that allowing a category, but not everything in that category would be doable administratively. I think that's a surprise to me. I thought that would be harder,
No,
but
it's
it sounds
easier.
like that would be easier.
Yeah, it's easier.
Okay. And what are I think there are 13 states right now, Janet, you might know better, that are fresh only. Sorry, this
Yeah,
Janet.
and I know 3 of them are in our region,
Yeah.
at least 3.
And what would be the barriers to going more in those states, or from your experience, expanding to other forms?
Yeah, actually, we've looked at perhaps authorizing frozen. And I think if some of the, like what was mentioned on the can, if it was just certain, maybe more nutrient-dense options in can, we might also, consider that down the road. But I think that looking at our participant surveys, and other states mentioned this too, because I know Nebraska and Utah, I believe, also only offered just fresh of the ones who responded. But that's what our participants were mostly interested in as well. which is another reason why we chose what we chose. But not to say that, because we need to look at all the different options of ways we can get people to purchase more of the WIC food package.
Thank you. Lindsay, you touched on beans, and I think that the primary question, the food policy options report that Melissa talked to us about this morning, it indicates that canned beans are allowed by about 42 states, so not all of them. Here in California, canned beans are only allowed in the homeless package, as an example. So wanted to know more about what you're allowing in your states and what concerns you would have about canned beans being required as opposed to optional.
You want me to take that one first, or no?
Go for it.
So in Texas, it's available for children over age 2 and all women. Under age 2, we have an MIS constraint, and that's the only reason we don't offer it for that age group. But we are moving to a new MIS and hope that that will remedy it. So it is a common option within our food packages. We honestly added it because we had food funds available that we could provide some more flexibility. It wasn't because we were necessarily hearing a huge demand for it. I pulled some redemption data from this past January, and 63% by unit was canned versus dried. But the option is 4 cans for 1 pound. So if you divide it by 4, technically there's more participants that are redeeming dried than canned. So from a cost perspective, it wasn't a huge implication. It is something that's being used, but they're more largely choosing the dried option in our state.
Thank you.
And
Mary?
do you want me, I was supposed
Go
to
for
say
it.
that, but
Yep.
it's really the same,
Same answer?
pretty much. In cost containment is always an issue, but we've been successful in other areas, so we felt that, again, we wanted to offer the most variety to our participants. So
Are all of you offering canned?
we offer it for all participants.
No, we don't.
So,
And I saw maybe a question about what MIS, was that what you were asking? Yeah, it's our computer system, and many of us have rather antiquated systems and that have sort of developed like an old house with rooms added on, and so it's very challenging to change the system and add another line or, whatever these people do. And so we're kind of in that place right now too, that we're hopefully so close to having a new system to put our data and all our redemption information into, that to try to take time away from developing the new one to try to change the old one is prohibitive just in terms of our timelines.
so it doesn't sound like the cost is the issue, it's more of a MIS functionality issue.
Yeah, and there are a lot of families for whom, the storage is an issue, so that would be a really good thing to be able to offer.
Okay, that's really helpful. Thank you. I'm going to skip around a little. I know you guys have some, the same thing I do, so I'm going to go off order. You all okay? I'm sure it's good. Mostly because I want to stay in administration a little longer and then loop back to the breastfeeding questions. So I would like to know, or we would like to know more about your process for updating your food lists. So on your form, this is question 8, how you evaluate market changes, like changes in product composition and size, and you all brought up this issue of package size, price and availability. We don't have all day to stay on this topic, but this is something that we feel you all know quite a lot about, and we know very, very little about. So if you could start, Janet, Jack, and Charles.
Okay. Well, this is a lot of work. I'll just say that, and I can tell you it's not why dietitians went to graduate school to do this work. Historically, this has been a 3-year cycle for Washington, where we updated the food list over the course of the year. We invited manufacturers to give us information that we could evaluate the food product and get the labels all lined up and be sure that we're looking at both the content and the cost and the accessibility across the state and acceptability from our participants. It was published at one time with a beginning and end date for 3 years, and we just sort of held off for in between times for making any changes. The market, I think, it must be more volatile than it used to be because I wasn't there a long time ago, but it seemed like there were so many changes that happened either with USDA rules or with the product size or the labels that we were not able to keep it current. So we are not putting an end date on them anymore. We just have a start date and try to get the word out when we are ready to do that. But we are doing ongoing surveillance around food products. Our vendor monitors help with that. We have a person who's assigned to stay in touch with manufacturers to get information from them. We get reports from vendors about not having a product, or certainly clients at the store saying, I'm looking for this thing and it's not there. Products go away and we don't always know that's happened. So there's national trend data, which is helpful, but it doesn't always translate to the shopping cart in Centralia, Washington, in terms of what they have on their shelves. So it's really it's a lot of intensive resource to manage that and to keep the food list up to date and current, and keep your vendors all using the same materials, and it's quite a system. Not why I went to graduate school, I can tell you that. But-
Thank you.
And, very similar experience that Janet has. And we've gone to just saying our food list revision, this is the effective date with no end date for that very same reason. And we used to do it on an every 2-year basis, but that it seems like it's been more on an annual basis for all the reasons that were mentioned by Janet. And we do, on an ongoing basis, we get information from manufacturers as far as we require electronic labels for everything and all the different sizes. We look at the additional nutrition information that we also ask for, the suggested pricing, and then the availability in Wyoming, of which we use our local vendor monitors to be out, going out to the stores to checking on as well. And then we also, on our food WIC participant survey every year, we ask what foods might people like to have included, and then we look at cost, clearly, because that's an important consideration. And in the other states in our region, Iowa still does update theirs every 3 years, Utah every year, and those are the only 2 other states that responded.
Thank you. Lindsay.
So in Texas, everything's bigger in Texas, right? So, I think that in some cases when USDA will publish regulations with certain package sizes, the hope is that manufacturers will respond. And in some cases that doesn't happen. In Texas, it kind of does. And so we've been very fortunate in that way. When the 16-ounce bread was required, manufacturers responded. We got the 16-ounce pasta right away. So we've been very fortunate that we still struggle with package size issues, but in terms of the market changes, they don't tend to get swept out from under us. in that
With
way.
800,000 participants, it helps. Maybe you could bring Janet along.
Yeah, unfortunately, we do not have that same experience.
But I will say that having a strong relationship with the vendor community is really, really critical. Just this past week, we got a call from one of our major vendors saying that the pineapple crop was having a problem, and so the juice price was through the roof. So we instantly go back and do an analysis of redemptions and potential need to raise that prepayment edit for vendors across the state. So they do a really good job of alerting us ahead of time, and we go out and obviously check what's in the marketplace as well, go to food shows, really try and keep an eye on what's out there. We also have an open enrollment period annually for cereal, oatmeal, canned beans, tofu, soy milk, pasta, and yogurt. So we can kind of get a feel for what's coming in the market that year.
Like health insurance, there's an open enrollment period.
It is.
Okay,
You get on or you
Do you have
don't.
navigators?
thank you. I'm seeing if we had any more. Mary, did you want to comment on that any further?
Yeah, I mean, we do a lot of what the other states do. We do have an annual enrollment. We don't have an expiration to our food list. We make changes. We added the yogurt recently, the white potatoes. Anything that's any brand, I mean, there's a printed food list that all states have, but items that are designated as any brand, we can update our APL. So if a new item comes in, things like that shouldn't have to wait. That doesn't make any sense. So if we get a new canned item or new peanut butter or something that falls in that category, we do that right away. There's really no point in waiting. We have really good relationships with a lot of our major manufacturers. Honestly, I probably do something on the food list every single day between our major, General Mills, Kellogg's. They're very good at letting us know if anything is changing in the market, being discontinued, or if the ingredients are going to be changing. Some of the products became whole grain that weren't whole grain. They were, our major manufacturers were very helpful when we added the yogurt. We have a really strong vendor advisory council, and we listen a lot to what our retailers tell us as well. That is huge. And when we first put the yogurt on, our little stores could not. We started off with store brand, which didn't work out so well, and our little stores were telling us that they couldn't find it, and we had to listen, and so then we decided we needed to add more options, and our participants were saying as well that they were having a hard time, especially finding the whole milk yogurt. So we, sometimes in the middle of the year, we'll change out our food list, we send out a notice. We always find it's easy to add something. You can do that on the fly. You can't take something off once people have been given benefits, because they're not going to know of the changes. But when you add something, if they don't know that you added a new product, it's not a big deal. Obviously, we want them to be up to date, but we also have since we're on EBT, we have a shopper app that probably 2/3 of our families are using, so that if we add, say, a new yogurt, when they go to look up that item, all the new products appear as soon as we add them to the APL. So we do a lot, and we really try to keep it. We really don't like to make products wait if we don't have to, if it benefits everybody. The pasta wasn't a great option because the sizes weren't really there, but given with WIC, you can pick at the store level, so if they couldn't find the pasta, they could get something else. Whereas in the check world, the participant may have gone without, and they would have to go back to the program to get a new voucher for something else. So we do always consider that we want to give as much as we can. So, but it is like a daily occurrence.
This
pretty
sounds
much
like a couple
for a lot of
full-time
us.
jobs,
Yeah.
FTEs on all of your staff, right?
Well, not all, because some of us are so small that one person wears several hats.
That you do it all.
It is a full-time job, but you don't have a full-time person to do it.
That's interesting. A quick throwback to this morning and the cultural panel with halal and kosher. I think what I'm hearing from you now and from that discussion, if there's an item, you can add it to the food list tomorrow, maybe not tomorrow, but quickly. If let's say it's an option that's one of the WIC foods that is halal or kosher, your assessment would have to be probably to be looking at the cost of that item to see if it's going to break the bank, perhaps. But that could be that already is part of your regular analysis of the marketplace. Is that an accurate conclusion? So.
Yeah, it's not easy for us to add with checks, but, and the other thing is, the cost is also affects what she was talking about, the reimbursement level, over which the stores will get bank fees if we change something and allow something that the banking system, at least in our state, if the banking system is going to reject it. So it's not just, yes, that's an okay price. There's another ripple in terms of what we have to do in the system for how checks are paid to the stores.
Okay.
Does that make sense?
Well, it does, and I think that could be a 4-hour conversation.
Yes.
So for those of us really interested, we'll pull you aside in the hall after this. Thank you.
One other thing on the note you're saying though, Shannon, is if it's not available statewide, that's another factor in not allowing it. So you may have halal items that are available in one region of the state. We're not going to add it and then put it on our information for participants because most of our participants wouldn't be able to find it or get it.
That's a
So
very
that's
good
another
point.
important consideration.
So availability and nationwide distribution has to be there in order for you to consider it for your food list. And in your
Statewide.
case,
Statewide, yeah.
Yes. For
Nationwide
us, we need to be thinking
Yeah.
about nationwide, and each of you have to think about
Yeah.
statewide. Yeah. Okay, thank you. I want to move briefly then on to cost containment. I'm sure it's your favorite topic. Best part of your job, I bet. So how does it work in your state, and what are the major limitations that it poses? Are you aware of other specific challenges in states that aren't represented on this panel? But we would like to hear from you for a moment on cost containment strategies. And Lindsay, I'll start with you.
Sure. So beyond the foods that are available directly in the store and some of the details of the cost containment I'm going to talk about at length, the formula rebate and the Medicaid reimbursement we get for special formulas is a big part of why our food package costs are low as well. So Texas gets quoted as having the lowest food package cost in the country, and that's true, but those two components are huge, and that's part of why our cost containment is as low as it is. But in the traditional sense, we do require least expensive brands, and that goes across for milk, cheese, dried beans and peas, whole wheat bread, corn and wheat tortillas, and also brown rice. So I mentioned earlier that we have 2,200 outlets. Each outlet declares their least expensive brand for each of those items. So you can go into store A and you can buy this brand of bread. If you go into the same type store across the street, they may have a different brand of bread that you're allowed to buy if you're on WIC. So it becomes a highly complicated shopping experience. It's on the vendor to label the shelf with a pink sticker for these least expensive brand items, and we hold them accountable for that, but with 2,200 vendors, it's a huge endeavor. And I think our vendors, I mentioned we have a wonderful relationship with them. They want to get it right, but it's highly complicated for them too. And the labeling that's required for them outside of the WIC program is tremendous from their corporate end. So it's highly challenging, but it's effective. So that's the first component. The second component is a not to exceed amount, and that's a prepayment edit for every subcategory of food on the program. And it's set at a high enough level that it applies to the state. So we'll go with the highest level for the potential prices that may come up across the state. And so what that does is when the EBT system runs a claim, it's going to look at that max amount, and it won't run a claim that's over that amount for that given food. At the end of the month, we then have different peer groups based on where the vendor is located and how much sales they do overall in their store. And we run an analysis of them with their peers. And so after that month's end, when we've done that analysis, we might recoup more based on how much they priced that given food item versus their peers. And that additional amount, called the maximum allowable reimbursement, would be taken out on their next claim. If they get enough recouped a couple months in a row, that might get them in trouble with us from a compliance standpoint. On top of that, we do a competitive pricing analysis after the month. So they may have not hit the prepayment edit. They may have not had more recouped after that month when we've analyzed them with their peers, but let's say they're going right up to that maximum allowable reimbursement every month. Then they're not necessarily competitive with their peers. They're kind of learning where they can go. And so we may get into some issues there as well. So we run a competitive pricing criterion analysis as well.
Can I ask you just a quick question? There it went. I knew I would do that eventually. The LEB is, of course, visible to the participant because they have to shop finding that least expensive brand. And Marie and I got to shop in Texas and look for the pink sticker to find the right milk. The other two, is that visible to the participant?
No.
That's all back house?
It's all back house.
Okay. Thank you.
It's all back house. Now on the LEB, different states run compliance on that differently. In our state, we actually look at the redemption data, and they have to claim at least 85% of their claims on that item have to be an LEB. And if not, that puts them out of compliance. Other states do it on an honor system. So the benefits are obviously very low food package costs, exceptionally low food package costs. And at some level, we've set it so that the market can help dictate where that prepayment edit and the postpayment edit is. We've really tried to set up peer categories that make it market driven. The risks are that it really creates an obstacle course for the shopping experience. It legitimately makes it extremely difficult. I've been on multiple shopping experiences this past year where they know it's the Texas WIC director in the store. They have their manager doing the checkout lane in test mode, and I still get the wrong food, and the stuff that's supposed to scan doesn't scan. It's extremely difficult to shop in Texas, but it's very cost effective.
I did the same thing. It was fun. But
I think it also can amplify the stigma. While our stores are not supposed to allocate a single lane for the WIC shopper, understandably, sometimes they do. And so you can have a WIC participant that comes up with a full basket, and they're not told until they've gotten to the front of the line and items start scanning, they're the WIC shopper, go to that lane. It happens, and we get complaints about it, and it's because of how complicated the cost containment is in our state. You heard a little bit about the Shopper app, and it's incredible technology that we've heard has been extremely helpful. But what I mentioned to you in the LEB process, the least expensive brand, is that it's specific to location. So that Shopper app doesn't work in our state, because unless it knows what location you're at, it's going to tell you that any one of those least expensive brands of bread are correct. So that shopper's going to get the wrong information when they scan it. So we're trying to develop our own app in-house to accommodate for that. But I'm just trying to give you a flavor of some of the risks involved with the way we do cost containment. It's highly effective, but it requires a lot of education, a lot of coordination with the vendors, and it's very, very difficult to implement and make sure that there's a smooth shopping experience.
thank you. Anyone else want to wrestle with this one?
Yeah, actually, I was assigned this one as
Excellent.
well. So, like Texas, we do some food list restrictions. We have least expensive brand requirements for our milk and our eggs, but ours is a little different where it's more of a recommendation, because when you go to EBT, unless you every week for every store, exclude some of the UPC codes, you can't, there's really no way to manage that. We're not going to go to the level that Texas does, but we did find, looking at our data, that about 90% of the milk is the least expensive of what we call the store brand that is purchased. So it does seem to be working fairly well. And also with EBT, you can exclude a lot of the higher price, especially with the eggs, the organic eggs or the Eggland's Best or the cage-free. You can exclude them from your APL file. And the same thing with the milk. So it's really, it is somewhat of an honor system, but it does work. We're just keeping it because it's working. It's not 100%, but that's the way that it is. We're trying. We do limit package sizes for our cereal. 12-ounce boxes are larger. The smaller boxes tend to have higher prices per ounce. We restrict some of the higher options for cheese, higher priced options like the deli cheese or some imported cheeses. We do allow store brand options for most foods. We don't find that, especially with the cereals, that those are the items that are being purchased, but we allow the full, everything, that store brand that's allowed, it is on our food list and it is available for purchase. We did at one point go to juice and cheese store brand only, and we got so many complaints that we had to pull it back. It was really causing a lot of problems, and we found that a lot of the name brands were cheaper because they went on sale a lot. And, our participants were saying, well, the Juicy Juice is cheaper, why can't I buy that? And it really created a lot of problems. So we took that back, and now we're back to, we don't restrict the brands as much on those. We exclude some expensive brands. I don't want to name brands, but if we find that our brands in juices or certain products that just seem to be much more expensive, we don't allow them. We just don't approve them on our food list. When we put the yogurt on, we only put on the 32-ounce container. Some states like to issue that at the ounce level, which means you could buy, instead of a tub, you can buy a bunch of the little small containers of yogurt, and it's about double the cost to do it that way. And we have found the variety of the tubs of yogurt has really increased a lot, even since we put it on. We do a lot of work with our vendors when we authorize them for the program. There's a very competitive price selection criteria, and we don't authorize vendors that don't meet the price criteria. We do a lot very similar to Texas with, we call them NTE levels, and they're in place. Now we can actually place it for each item by peer group, so it's very, it really comes right down to that particular item. It's not even just the food type, like it used to be juice. Now you can just say this brand and this container and this peer group, this is the max. And that is good. It doesn't impact. Stores don't lose out money like they did with checks. We just cut it back on the back end. And they're not paying bank fees, and participants aren't really noticing any issues with that. So we basically do a lot of work on the back end that the stores do see, and it's mostly our small stores that see the reductions in payment. But those are good things to do because it doesn't impact your participant selection. So basically a lot of the same. But
So it sounds like your jobs, a lot of your jobs is the balance between cost containment and providing foods that participants want.
yes.
So,
That's
and it's
really,
that
really
dance that you're
important to
doing
us.
pretty darn daily.
Yeah, and it's so important because especially when we did the juice and the cheese, that was the most backlash I think we've ever gotten on anything. And people said, well, now this is, and I hate to say it, but we have to buy like what is this, like WIC or welfare juice or cheese? And that's kind of what they were saying to us. And we're like, why can't we buy what everybody else buys? And and then we did look at a lot of those name brand things do go on sale a lot. But at that point, we were in a really severe, like most states, a really severe fiscal crisis, and we had to really look hard. But I don't think we'd ever do something like that again. We look at other ways that aren't so severe, because we do want our participants to be able to buy their foods and have a good shopping experience.
Thank you.
So.
I'm going to go off script for a second because we've had a really nice morning and afternoon of comments today. And I wondered, in response to Dr. Gunderson, he's somewhere up there in the light. There you are. He commented that child participation seems to be influenced by the food package. Yell out if I have misinterpreted. Okay. And I wondered if any of you wanted to respond to that in any way.
Well, I think that there is, I'll go first, okay? I think that there's something to be said for that in terms of keeping kids interested, and I think that but I also believe that there's a lifestyle issue that's involved with families that are trying to get around with 3 kids and 2 jobs and all those kinds of things, and it does get more complicated as the kids are older. But I think that, I think there is something to be said for looking at things that we might add or increase as children are older, so that the benefit from that standpoint, now the benefit of WIC is really not about the food, because we're not a poverty program, we're a nutrition program, and nutrition education is an important part of that. But some way to engage those parents around those kids and have a package that's more appealing might be helpful. I don't really have any suggestion for that, except, I think we don't, back to the cost containment, we don't approve string cheese because of the cost, but that's a convenient food that people like, and people on the go. I have some in my bag, so, it would be good if we could do that, if we could wiggle the cost containment around being more attractive to our clients. I don't think we should wiggle our nutrition requirements much, but I think the other piece in terms of meeting family needs is a good thing to look at.
And I was just going to add, because Janet reminded me that was one of the requests that we had, to add back string cheese. And because we typically have had the second lowest food cost in the nation, which is interesting, because we do more of a variety, more like Mary, and some of the things for like a store brand for milk and eggs and cheese, but we have a pretty much a middle-of-the-road food package, I guess is how I would describe it. But adding back string cheese was huge for our participants, just that little thing, and it didn't really impact our food costs that much. And interestingly, we don't have the option in Wyoming to have Medicaid as the first payer, because they have to be mandatory. But even with that, with us providing those formulas, we're somehow still able to maintain. But again, it's a difference. Our caseloads the sizes are so different, and demographics are so different.
And you're referring to first payer therapeutic formula?
Yes, yes.
So that all of our committee members?
Yes.
Great.
So we've done a lot of research with participants over the past 2 years, and what we consistently hear is the shopping experience is the #1 reason they don't come back, not the food package itself. They certainly have suggestions about the food package, but that's not the reason they're not coming back. Additionally, we've done some really interesting research with them called projective techniques, and it's a very different way of getting at more heart button type conversations with participants about their experience. We know that when we ask survey data of participants, a lot of times we're getting desired answers, especially when it's asked in the WIC clinic. So these types of questions are more like, draw me a picture of your experience with a nutritionist. What did she say, and what did you think she was saying? And things like that. And I bring that up because we asked about how much they would pay for the service they got from the breastfeeding peer counselor. Not that they would have to ever pay, but how much would they pay? And one of the pictures was $40. And from a low-income family, I think that the value of WIC is not just in the food package. And I think that that's a really important component to remember that is key to this public health program. It's not just about the food package. And so retention certainly plays a part in the food package, but it's not the instrumental reason that people aren't coming back.
So whatever we decide, you'll be fine. Do we all feel better now? Any other comments? I have two next questions on breastfeeding and the breastfeeding packages. All right, I'm going to ask those two, and then I'm going to open up to committee members to also ask the panel questions. And if there's more time after that, we'll keep going. But these are 6 and 7 on your lists. As summarized in the Phase 1 report, which I'm sure you read every word, it was only 500 pages. But we know the literature is mixed on whether the breastfeeding incentives that were built into the 2009 food package changes were successful in increasing breastfeeding across the country. So we'd like to know about your experiences and your thoughts on incentives or strategies that you would suggest to improve breastfeeding support. And sky's the limit, ladies. We'd love to hear your ideas.
I think many of the suggestions that we had for truly making the fully breastfeeding package truly enhanced so that it feels a true step above what a mom who's not fully breastfeeding, would receive, have already been mentioned. Just the ability to provide a greatly increased fruit and vegetable CVB. I think that's some of the feedback that we've gotten from the moms. We do have instances where a mom will, when she is fully breastfeeding but decides to start supplementing with some formula, we often, when you say to her you will not receive your enhanced food package anymore, they opt to just buy that can of formula on their own. And for our system, they remain fully breastfeeding. And so it does have some value, and I think it has increased our breastfeeding rate, our duration rate probably too. Our breastfeeding rate since the 2009 rollout of the food packages increased by 21%. So I think that's pretty significant, except for the 1 year where we'll talk about probably in a minute, where we drew the line in the sand and did not offer that can of formula in the first month of life. It dropped by 24%. And then the next month, and the next year, when we said, okay, we're not doing that again, and offered them the option to stay partially breastfeeding and have the can of formula, I think it just made the conversation with the peer counselor and the participant a much easier, less forceful conversation, if you will.
Can you describe that more fully for the committee? What was the change? and
You're
how
nodding
did-
on that question, I'm sorry, but it does
No,
tie in, so is that okay?
Keep going, Debbie. You're doing
Well,
great.
it's all just the breastfeeding enhanced food package, but the way we interpreted regulation to be was that if you had three options. You could be fully breastfeeding, fully formula feeding, or you could either in the first month of life be fully breastfeeding or fully formula, no partial. And so so we drew the line in the sand for that 1 year and said that if a mom wants a can of formula, then she becomes a fully formula feeding mom. And so we gave no can of formula in the first month of life. And what we saw, as I said, was that I think it was my figures may be wrong, 24% or a huge drop in the rate. And then the next year.
In the
we
rate of
said-
breastfeeding.
In the rate of breastfeeding, the rate of breastfeeding, not breastfeeding initiation, but our snapshot in time picture of how many moms are breastfeeding. And when we took the line out of the sand and the next year said a can of formula is an option and you can be partially breastfeeding, then we saw like a 14% increase the very next year in breastfeeding. But overall, from the rollout of the food package and the enhanced breastfeeding package until now, we saw a 21% increase in breastfeeding. So we do think there's a huge value in the enhancement of the breastfeeding package, and we'd like to see the things I mentioned, maybe the canned fish, the yogurt, the cottage cheese, increases in all of those additional amounts of food we think would be helpful. And along with that, to continue, and I was so glad to hear the proposed funding for the peer counselor program for the upcoming years, but to continue and increase the peer counselor program, because we do think it's extremely valuable and it's detrimental to breastfeeding when you don't have the peer counselors available.
I'd like to second that. The breastfeeding peer counseling program has been shown to have a positive impact on breastfeeding duration. We have a pretty good initiation, but we have some challenges around duration. And since, the food dollars that we get are restricted, I don't know if you know that part, but we can't spend it on anything but food except breast pumps. And we think maybe there would be an incentive for states, maybe even more cost containment, if we could spend some of that on breastfeeding peer counselors, because our state doesn't have peer counselors all across the state. We're struggling a little bit in that program. And it just is, it's just really an important thing to be doing, because if, tomorrow is Friday, tomorrow night, new mom, 3-day-old baby's crying and she's trying to breastfeed and she's concerned that her milk is not sufficient, and she's got to wait till Monday to call the clinic, to call the WIC clinic and say, I need help. I don't know how many of you have been in that situation, but that's not a happy time for the mom. And so if she's got a peer counselor she can call instead of going to the store and buying a can of formula, somebody who will talk to her at that moment and help her, see what her options are. That's a really positive thing and really critical to maintaining duration for breastfeeding. So would like to see some flexibility about how we support that program.
Peer counseling program.
Yes.
Which is currently a separate funding stream from our WIC funds.
Right,
our
but I'm
core service
suggesting it
funds.
could be.
Right. I hear that suggestion.
Okay.
But, so how in Washington, I'm going to merge questions 6 and 7 because you've done such a nice job of that, Debbie. So in Washington, how do you interpret the regulations around the issuance of formula to breastfeeding infants, and how's this working in Washington?
Boy, I was really hoping you weren't going to ask me that. I had to go to class last week to
Did I skip? Okay, well, you're welcome to pass if you feel more comfortable.
let me pass and ponder. I'll see if I can
No
remember my
problem.
notes.
I wasn't looking at who I was supposed to be asking, so it's just Chickasaw.
I'd weigh in on that, and I know this is probably one of the most confusing things about, for staff in particular, and for people like me. But, just a couple of things just in general about breastfeeding. As far as then I'll address that, but the response to the breastfeeding food package, I think is mixed, because if you look at, for example, the redemption of tuna, it's 41%. So is that part of an incentive? But on the other hand, we've heard from many local agencies and participants that having more in that breastfeeding food package really does incentivize, and it makes it the focus of the program on breastfeeding. And in fact, some participants have even told us that they didn't realize that WIC offered formula. They thought we were about breastfeeding, which is fabulous. That's exactly what we want. And we do what's the confusing part is about and we understand it the same way you do, Debbie, as, you know, you can either be exclusively breastfeeding or fully formula feeding in that first month, or you have that state option of offering up to 1 can of formula in that first month. But again, then a woman would forego the fully breastfeeding food package. And it's, you know, we did choose to not use the 1 can of formula, and so we're kind of the all or nothing. And it hasn't seemed, although we were hearing more from our staff lately that they feel like for some people, it pushes them more towards, well, you know, they'll again give up the breastfeeding food package because they feel like they need formula, but then technically they're classified as a fully formula for that first month. Once they're older, we can change them back to more correctly partially breastfeeding. But that's very complicated, even in terms of the systems that we deal with. I don't know what the answer is, but it has not impacted our total breastfeeding rates or our exclusively breastfeeding rates, except to go upward. We've been trending upward for the last several years. I think our initiation is 78 to 80%. We do struggle with duration as well. But again, back to the peer counseling program, we only have enough money to have 11 of our 19 local agencies have them. But those agencies, they're at least 7 or 10, I can't remember if it's 7 or 10%, they're higher for exclusive breastfeeding in those places where we have peer counselors as compared to those that we don't. And I think others have had other, similar results with the program as well.
Right.
So maybe what Janet's suggesting.
Yeah. Well, and we're actually doing a study right now about comparing the breastfeeding rates in our peer counseling and our non-peer counseling agencies. And of course, there are a lot of other factors in there. We have some great agencies without that program who do great work with breastfeeding. But to look at actually even possibly looking for state funds, because we're that committed to having that program available. The other thing, a couple of things I wanted to say, and one is that we do see that request for the formula as an opportunity to do another breastfeeding assessment and to really work with the mom about what's happening, what's the problem, what kind of support can we give. It's an opportunity for a good conversation and often that will make a difference in terms of their willingness to go out and go out happy without formula and being ready to try again. The other thing I was just going to show, I'll leave this with you, but it's so complicated. We had to have a flow sheet to say, if this, then that, and then if they, this is starting out in breastfeeding, and if they change, you do this whole thing, and if they don't want to, and then you have to do, it's very confusing. And you have to remember that we do have registered dietitians, but we have paraprofessional staff as well. And they got to figure this out, and then it affects the breastfeeding rate, and it's very complex. I don't have a solution to that either, but.
Thank you for trying.
Yeah.
Yes. I think what I'm hearing, and I want you to either confirm or correct it, is the food is nice, the additional foods in the food package is nice, but perhaps not sufficient. And that the support, whether you all mentioned peer counseling, is essential.
Yes, yeah.
So given that we are the WIC Food Package Committee, I think what I heard is the foods are helpful.
Yeah.
I want to get just a little bit more clarification because you've all shown us how complex the packages are and they can be in that first month. So what I think I'm hearing is that when you allow that 1 can, you effectively force choice a mom with a newborn into full breastfeeding or full formula.
Right.
Are there further questions from the committee on that?
It's regulation.
Yeah.
It was, guidance, not guidance, mandated from USDA.
The intent
To
was not
define
to
it that way.
interfere with the breastfeeding infant.
Right.
But the way that
Right.
it played out is
Right.
a little more complicated than that.
Right, fully support them in that, yeah. Don't give
Yes.
formula, give full support, help them with their breastfeeding. And yet, again, in those conversations, one-on-one with the paraprofessional, with the peer counselor, with the mom, they just, I think, felt like they were forced into something. It just didn't go well. It didn't go the way that it was intended.
Looking to committee members, because we have 10 and a half minutes to be 10 left, and I want to leave time for you all to come to the mics and ask additional questions that have come. So jump on up there and get in line.
Shannon, do you want us to do the cereal one too? or-
We're going to give them some time, and then if we have time, we're going to come back. Thank you. I'm going to start with Kathy on this side.
Okay. So we've heard today that several different things. One is that there seems to be a crisis with the children as they get older, that you are losing them on the program. We've also heard that the number one cause of people leaving the program is stigma, and WIC is supposed to be a program with the least amount of stigma of our food assistance program. So that stigma is still the number one problem, is a kind of a distressing fact. And when you put that together with the fact that WIC's benefit to the family unit as a whole is much greater in the first year than it is any subsequent time, it doesn't seem to be a surprise that if over time the family continued to experience the same level of stigma and the benefit was much less, that they would drop out. So that being the case, why make the shopping experience so damn complicated? It seems like cost containment is really backfiring on participation. It also seems like, from the point of the package development, that the committee probably needs to think about what's in the package for the young kids. But let me leave to you the cost containment, because that's, I mean, it makes a very unpleasant shopping experience. And if then you get to the checkout counter and you've got more problems and they send you to the WIC aisle, you just lost that participant.
Mary, are you online or offline EBT?
We're online.
Online, okay. There are some distinctive differences with the shopping experience depending on the type of EBT system that you have. Just to make that point, and I know it doesn't matter to you all, you don't want to go into that, but it's not always the same with every EBT system. The shopping experience can be very smooth and most times very good. Well, the way that EBT Online does cost containment is different, and that's what makes the shopping experience maybe a little better, is what I'm
I mean,
trying to say.
in Mass, our experience is smooth because we have an app, we have, you know, and I've honestly been behind people, and I didn't even know it was a WIC transaction. However, the cost containment does dictate what they can buy, so they get what, you know, we tell them to, but then they'll be calling saying, well, you know, you're a health program, why can't I get the organic milk, or why can't I get this, or why can't I get that? So they're getting what we give them, but they really want something else. So that's what the cost containment does for us. We have straightened out the shopping piece of it, but the kids are still dropping off the program. So it doesn't fix the problem necessarily. We thought that it would, but it's not. There's, right.
Right.
But we are doing a lot of other work to try to keep them, especially at that first appointment when the child turns 1. We're doing a lot of work on that, trying to get them in early and other things. And we're actually we've expanded our staff to have what we call a family support coordinator, because we find that there's so much other crisis going on with families that our staff can't handle that, so that's kind of taken off the, I mean, it doesn't help, it does help us with retention somewhat because they see us as a place to help them, even though it's not our job, but we've gotten some money to hire people to do that. But the cost does dictate what you can buy, even though you might look like you're having a good experience. You're really annoyed because you want to be buying something else. And then you call me and I say, well, because it costs too much money and we can't allow you to buy it, so.
Marion.
I had a question for Lindsay. And so you mentioned how the least expensive brand thing makes the shopping really complicated. Did you also find a decline in redemptions for those categories that are the least expensive brand after you implemented this?
You know, this stuff was all implemented before my time, so I'd have to go back and pull redemption data to answer your question on that. My sense, just anecdotally, is that participants are used to having to really search, and if it doesn't scan, they just walk away without the item. But in terms of aggregate redemptions, I'd have to pull that for you.
Okay.
Yes, I had a question for Lindsay, too. You mentioned this spike in pineapple prices, and I thought that was pretty interesting because you, but if you could explain more about the process of, if I understand it was juice, so how you were able to control that spike in price?
Sure. So the retailer contacted us and said, we're having a crisis with pineapple, or there's something going on with the crop. Lorelei would probably know. I actually don't know what the issue was. But they said, we're going to have to raise the price of pineapple juice. And so they're giving us a heads up because that not to exceed amount, which is the prepayment edit, they may have to go above it. So they're telling us that ahead of time. So then what we do is we contact the other vendors to make sure that that's actually happening across the board. And we start to do some analysis of how high we could go without affecting our overall costs. And we work to figure out where a landing point might be. So since that just happened this week, we haven't raised it yet, but it's likely we will. And so we'll sit down with our vendor management team and come up with a couple of proposals of how high to go. And then we'll watch where they redeem the next month. And we sort of stay in a flux there until it lands in the right place. But the gist of it is that we're not ignoring when market changes happen. Like when the eggs crisis happened, was that last year? We raised our NTE for that because we heard across the board egg prices are going up. We can't ask them to take a loss on WIC and things like that happen.
So, and if otherwise the store would have to make a decision about whether or not to sell the pineapple and take a loss.
Correct.
And take a loss on that because they're not going to get reimbursed.
Right.
Okay. Thank you.
So that works in a category of juice where you have other options. In a category of eggs where you're required to offer eggs, it's a different ballgame.
Correct. Yeah.
Angela.
This question is for Janet Moran. I was really interested in hearing that you asked your participants what foods they would want and then made a change. I wanted to make sure that I understood that correctly, that there was a request for string cheese and now you added string cheese to the allowable form of cheese?
Yeah, well, it was one of those, we had it on before, and then, 2 or 3 years ago, when we also had to look at various cost containment measures, we took it off because of the expense. But it had, a negative impact on our, that was something that our participants really wanted. And again, if we can afford to provide a variety of foods, that's what we'll do. So we did add it back on. And to date, it hasn't had any negative, cost implications. We've been able to continue to afford to provide that along with the other variety of foods. I don't know if that answers your question.
No, that does. And I was wondering if you could talk more about what other types of foods that they requested and if there were other modifications that you made and how it went.
Well, it's more of, like everyone else has said, they ask for more fruits and vegetables, but we're bound by the limits of the food package. So I think that would be probably an overall general statement that it sounds like all states would concur that would be important. I'm trying to think of, while we've had some, backlash, as other folks have mentioned, about removing the, 2% ability to buy 2% milk. And it has affected our redemption rates in a negative way for milk overall, as I mentioned. So that's something, but again, we given the rules to date, we aren't able to affect any change in that area. Sometimes people ask for, I'm trying to think of an example of a food that we wouldn't be able to provide. But it's just interesting, and our survey data for this year, we typically do January, February, March, and so we'll have more data available this month that perhaps we could share, more broadly if that would be of interest. So.
I'm thinking maybe WIC has solved a national food crisis, because if there's one thing I hear repeatedly, in not just this meeting, but in several meetings, is the popularity of the CVV and how popular it is with the ability to purchase fresh fruit and vegetables. And yet we see the consumption data, and it always shows that if there's one thing people don't want to buy, it's fresh fruit and vegetables. There's an underconsumption of fruits and vegetables. So I'm wondering, I'm not really understanding sort of that dichotomy, and I'm wondering, is it really this discovery of all of a sudden, well, we get free fruits and vegetables and it's better than we thought it was, so we're going to eat it now? Or is it just something maybe related to something like Craig was saying, it's this, well, it's the freedom to choose, and they give us this freedom to choose, and we can buy whatever fruits and vegetables. And we just like it because we now have this freedom, and we don't have to choose the lowest brand string cheese or whatever the item might be. Do you have any insight on what might be going on there?
I'll answer from a non-data perspective, but just from sort of personal opinion and experience over the years in obesity prevention as well. Typically, consumption data includes juice, so fruit is always going to look high, and that's separate from the CVV benefit. So that's something always to consider when you're looking at juice as part of the consumption for fruit and where that falls on the different population consumption patterns. I think that whether it's perception or reality, fruits and vegetables are perceived to be a high-cost item, particularly among the low-income population. So I think it's valued a lot, and it's given as a dollar benefit as opposed to ounces of something. So I think that there's a lot there to say, wow, I have the ability to purchase this highly valued product, and so it makes it a higher redemption item. Split tender is something that's coming that hasn't been implemented yet, but I would suspect that once that happens, that we may, you guys don't know what split tender is, I'm sorry. Right now, you have the max dollar amount for fruits and vegetables that you can purchase, and you can only go up to that amount. Split tender basically means that if you go up to the checkout and the produce that you've put up there costs more than what's on your card, you'll have the ability to pay for it with another means. I would suspect that when that's implemented, we'll see redemptions go up even further because that's made it a little more difficult to redeem the benefit as well.
And I would agree with Lindsay that that might be why we're seeing, you know, a less than 100% or less than 95% or whatever redemption, because literally you would have to take a banana away to complete the transaction. And then I also wanted to mention that I was just thinking of the survey data in the last couple of years for whatever it's worth, and maybe we're hearing from the people that are buying the fruits and vegetables, but it was, you know, consistently between 83 and 85% of all the participants surveyed, and we do about 20% of our caseloads. That's a pretty significant number. You know, they did say that WIC has definitely helped them be able to purchase and eat more fresh fruits and vegetables. So,
Right. And we do allow the split tender, but our redemption rates is still at about 85%. So I'm not sure why that is, but we do allow it.
I think anecdotally, too, this is not science, but for some clients it is, they use their WIC check to buy things they wouldn't buy with their own money in terms of the fruits and vegetables, maybe, so there's a little more experimenting in a sense that they can buy the apples, but they might buy, you know, some more expensive berries or something with their checks that they wouldn't normally try. So I think it's an expansion in addition to, in terms of what people are willing to buy for some.
Well, friends, we've passed over our time, and I didn't even get to whole grains. So, and we have another comment, and are we okay to blow into the break time? Yes. All right, Suzanne, take it away.
Mine's a quick question, perhaps because there's no answer. The baby food meat, you've all said, and we've all heard that people are not using that. And yet, it would be so good to get some heme iron into those 6 to 12-month-olds. Any thoughts on what mothers might redeem other than the baby food? Is there a non-baby food option, or is it just hopeless?
I think that some of the research that we saw this morning provides a lot of important insight into considering the household rather than just the infant. If there was a heme iron source that was given to the family, and the family was educated about how to prepare that for the family, including the infant, it sounds like we might have a better opportunity to get some heme iron in the infant.
Well, we're out of time. I really appreciate all of your comments. We are having a break until, I don't know what time it is at the moment. Are we returning at 3:45, Marie?
Lean ground beef.
Marie? What time are we returning?
Oh, it is a hard one.
Iron drops?
I don't know.
So we have 10 minutes. Please come back at 3:45.
Because obviously, it's not a phenomenon just in any one part. It's, yeah.